Health information is everywhere. It's confusing. We're sitting down with doctors to help make sense of it.
Take me to Kraus.
Take me to Kraus.
Take me to Kraus. They saved my life.
Welcome to the podcast studio at Kraus Hospital. We are thrilled to have you here and very excited about our first guest. She's known by some people as the queen of women's health here in Central New York. Dr. Nellie Kazaz is a board-certified cardiologist. She was recently honored with the game ball at the SU women's basketball team, honored by the university and Kraus Health for her expertise. So welcome, Dr. Kazaz.
Thank you for this introduction. Thank you. That's a big responsibility to carry.
Well, we're going to do a deep dive today into two of your biggest passions, educating women about their number one killer, which is heart disease. And we'll also talk about something that everybody is talking about today, at least all women are, menopause and hormone replacement therapy. That is a hot topic.
Thank you.
But first, we're going to talk about heart disease because it kills more women than all cancers combined. How do we not know this?
It's so true, and that's where education of patients come as a very important part of what I do. And I always tell my patients they're also very important part of the education if they tell one friend or one neighbor or one family member about it. This is bad news that heart disease is the number one killer, but the good news is it's 80% preventable. Mm-hmm. So that's where my passion for prevention of heart disease come from.
Well, first, can you just explain why so many women do get heart disease, have heart attacks, and they're more likely than men to die from them? Our hearts must be different than men's hearts.
It is very true. We're not just smaller men. Women have very different cardiovascular system. Even though chest pain is still the first most common presentation, but women are more likely to present with atypical symptoms, which makes it less likely for women to realize that it could be their heart. It makes it less likely to be diagnosed appropriately and as rapidly as men. Right. And unfortunately, we tend to have smaller vessels, unusual presentation, delayed treatment that may lead to higher risk of death.
I read somewhere that 1 in 3 women who's having a heart attack has absolutely no chest pain.
It is so true.
I mean, for men, that's like the red light that keeps flashing. It's like, get to the hospital, and women also don't have like that clammy feeling and the pain down their left arm. What are the symptoms that women do get?
Correct. Not all women have these type of symptoms. We tend to have possibly atypical, considering shortness of breath, extreme fatigue, palpitations, heartburn, possibly excessive sweating. A lot of women tell me that they thought they had the flu.
Wow.
And when they present, and the misconception that women are less likely to have heart disease.
Right, you don't think of it. It's not like, I also was shocked to know that this extreme fatigue that you're talking about is not just you're tired for a couple of days, but for a few weeks prior to the heart attack. Somebody described it as like you're moving through mud and everything is hard and you're just sapped from energy.
My plea is to make sure don't self-diagnose. Seek help. You're less likely. It's much better to go with a false alarm than the other way around. Right. Because remember, time is muscle. If we delay the presentation, the likelihood of suffering from congestive heart failure and consequences of heart attack are much more likely. So early presentation, even if it's a false alarm, nobody gonna blame anyone for going to the doctor or to the emergency room to be evaluated for these vague symptoms.
So some women get some chest pain. Many women get extreme fatigue. Let's just go through some of the other unusual symptoms. Sometimes women will get tooth pain and they go to the dentist?
Jaw pain
Yeah.
is one of the things I always tell people. It raises a big flag for me as a cardiologist. Jaw pain, obviously, it could be your dental, dental need, but there is a very unique ache without in the absence of any acute dental care.
Right.
It usually happen with activity, or it wake you up from sleep suddenly,
Wow.
or radiation of the pain to the jaw. So jaw pain is definitely one of the, you could have it as a man or a woman, and it's a very alarming symptom for us cardiologists.
They say that the average man gets help within 16 hours of the onset of symptoms that are very obvious that something's wrong, and that women are not reaching out for help for like 2 days. More than 2 days they sit with this kind of thing.
It is true, but that's
Wow.
not only for cardiac. Women tend to have to be less likely to go. I tell my husband a lot of time, you worry when I stop worrying.
Oh,
we,
right.
right?
Yes.
So we worry, we
Yes.
push our significant others to go, and we're less likely. We're the sandwich generation too. A lot of women are between aging parents, ourselves, our jobs, our kids, possibly grandkids. So we prioritize everybody else
But us.
ahead of us, and that is one of the reasons. Unfortunately, there also, even when they seek help, there's still a discrepancy in the way they're heard and they're addressed. The women are still less likely to get an EKG as fast as men in the emergency room. They're less likely to see a specialist. They're less likely to get a stress test. So there is still even education beyond the patient population
Right.
and into the medical field about the risk of heart disease in women, particularly in menopausal age women.
Well, we have to advocate for ourselves. And really, what I'm hearing from you is if you're less likely to get all of those tests, you might be motivated to say, I really think something is wrong. Could it be my heart?
Could it?
That's a reasonable thing to say to a doctor in the emergency room.
Absolutely. And that's
Yeah.
where hopefully this type of education about your symptoms. I'm not saying every fatigue.
Right.
I'm not saying every jaw pain, every nausea,
Right.
every heartburn is cardiac, but rule that out because heart is what kills.
I guess, first of all, you need to know what your risk is. And most women today probably could tell you if they have a family history of breast cancer. It's been so much in the conversation, but not so much for heart disease.
Heart disease in your family means that you're more likely to have heart disease. That will urge you to start the prevention journey earlier. I want to urge people to talk about these things, and not only about heart attacks. Ask about the history of hypertension, the history of valvular heart disease, the history of congestive heart failure, and history of stroke. All of these are considered cardiovascular risks, which will increase our risk of having the same problems at the same age or an earlier age, depending on the environmental factors.
And you may also have a close relative who maybe died in their sleep. That could very well have been heart disease.
Absolutely.
Yeah.
Most sudden deaths are considered cardiac deaths, and unless there's confirmation with an autopsy is made, a lot of them are presumed to be cardiac, and it's very important, particularly if they happen at young age. And what we consider young age, 55 and below in men and 65 and below in women, is considered premature disease, and it will increase your risk as a family member.
So, you're the doctor. You are very focused on prevention. Are there some things that you're doing that we should all be doing?
Thank you for saying that. All my friends would say I live by what I preach.
Okay.
The best news about heart disease, it is 80% preventable. So the things that you need to know, first of all, knowledge is power. You need to know your blood pressure, you need to know your cholesterol, you need to know your blood sugar, you need to know your ideal weight. So that's what you need to start with.
Right.
Then you need to eat healthy, exercise regularly, avoid bad habits like heavy drinking, smoking, vaping. And the last important part that was recently added to the list is good sleep. 7 to 9 hours of sleep are essential to reduce the risk of cardiovascular disease.
Now you have all these people who are watching and listening going, uh-oh, I don't sleep enough. I don't have time to exercise. I'm not sure that I'm eating anywhere near as well as I could be or should be. So let's just break this down for people. How much exercise? Because you don't necessarily need to go out and run for a half an hour or 40 minutes a day. How much can you get away with and really make a difference in your heart
Absolutely.
health?
You do not have to be a marathon runner. You do not have to be an athlete. The American Heart Association had recommended 150 minutes a week of moderate level of exercise, which is brisk walking, which we could do around our kitchen table if we need to. And 150 minutes a week, meaning five times a week, 30 minutes at a
Right.
time, or 20 minutes a day.
And when you say brisk, you mean you can have a conversation with a friend, but you'd
Correct.
be a
You
little
can't
bit
sing,
breathy.
but you can talk.
You can't sing,
Yeah,
but you can talk.
talk. Yes.
Okay, you don't need a
If
gym for that?
You do not.
Right.
And that is very important. I talk about this every day in my office. People say, well, winter came. Winter come back every year,
Right.
unfortunately,
Yes.
around here.
3 things we should be adding to our diet that many people are not, that will make a difference.
Mediterranean, Mediterranean, Mediterranean.
Mm-hmm.
Olive oil, salmon, whitefish, tree nuts, almond, pistachios, hazelnuts, and fiber.
Mm-hmm. Vegetables,
I think I mentioned
right?
more.
All that
Obviously,
fiber.
yes,
Yeah.
absolutely.
And they say eat the rainbow. That's probably good for all kinds of health.
Correct. The
conditions.
brighter the fruit or the vegetable, the more the
better.
anti-inflammatory benefits in it. Absolutely.
What is more important, can you say? Is it genetics or is it lifestyle?
So, first of all, what we have to concentrate on what we can change. We cannot change our genetics.
Right.
So, there are 2 things in cardiology that we can't change that will increase our risk of heart disease. Aging, it's inevitable,
Right.
but we can control how we age. And our genetics is, we cannot change that. But working on the lifestyle and the risk factor modification is what we have control with. And that's what we need to concentrate on.
All right. When we come back, the subject that everybody is waiting to hear about, because Dr. Kazaz just got back from a major conference on menopause and hormonal replacement therapy.
Yes.
20-second break. We'll be right back.
For more information on what you're hearing on this podcast, go to kraus.org/carry. The information in this podcast is not intended as medical advice. It's always best to check with your doctor.
When I asked Dr. Kazaz to come on the podcast, she said, well, wait till I come back from this conference in Boston because I'm going to learn so much about women's health, menopause and hormone replacement therapy. You were just there last weekend.
It was amazing.
There was a study that was done about 20 years ago, the Women's Health Initiative, and one of the things that they looked at was what are the risks of giving women hormone replacement therapy to ease their symptoms of menopause. And the study came to some very frightening conclusions.
Correct.
And that was that the hormones could increase the risk of major disease, breast cancer, heart disease.
And it was discontinued early, and that was in 2002.
Right.
I still remember I was in training for cardiology at the time.
So automatically, doctors were like, okay, you're going to have to suffer. The hot flashes won't kill you, and all of these things, but a heart attack can, breast cancer can. And so really, Dr. Kazaz, we have a whole generation of women who missed the boat on what we now know is just the opposite, that hormone replacement therapy can help women prevent these diseases and stay healthier. What did you learn in the conference about how we can now do better for women?
So it's very important to identify the problems with that study. And you're right, we lost a generation of doctors trained to take care of women, and we lost generation of women that died from possibly preventable diseases. First of all, in medicine, we don't always do things to save lives. Okay, we don't replace a knee to save lives, but it improves lifestyle.
Right.
It improves
Quality
the
of life.
quality of
Sure.
life. That is very important to remember. Not everything in medicine is about saving lives. And it's very important to not ignore the major symptoms that happen during that time of perimenopause and menopause. And treating symptoms is a very critical part of that life period. Most women live 40% of their lifetime in menopause.
Wow.
40% of your life you live it in menopause.
Well, I guess you think about it.
It is so
Starting
true.
in maybe
It
your
did stop
40s?
me when it was
Wow.
told in the conference.
Right.
I had to stop and think about it. So
So from what you heard at that conference, and I know obviously this was not all news to you because you are a passionate advocate of doing whatever we can and whatever the science supports, would you have any doubts in your own mind about taking hormone replacement
no,
therapy?
and I do it myself. I say that I am on hormonal replacement treatment.
And does it help?
Oh, absolutely. It changed my life in the last few years since I started it. And the interesting part is I presented with frozen shoulder, and I was taken very good care of by my colleagues in ortho, and I assumed it's because I box
Oh, yeah, of
for
course you would-
fitness,
yeah.
and I heard it. And it turned out it was low estrogen.
Wow.
Lower estrogen is what caused my frozen shoulder. And I don't only sleep better, I feel better. I'm much more myself. My mood is different, and I definitely. I say something, I don't know if I should say it here. I say, you will take my patch off my dead body.
Oh, well, that nobody's going to take your patch away. I can be sure after that.
Yeah, sorry.
Well, no, this is
It's personal. I
Yes.
think people will feel different when I say that. But, obviously I talked to my OBGYN about the perfect combination for me
Right.
and appropriate use of it and the dosage, yes.
Yeah. Well, this has been so interesting and informative, and I just really appreciate the way you are giving women agency to learn and advocate and recognize that, again, quality of life is so important, and that is the reason to make sure that they are getting the health care that they deserve, right?
Prevention of osteoporosis, hip fracture is the most common reason for admitting older women to
Right.
hospitals. It can lead to major complications, and that is a known fact.
Dr. Nelly Kazaz, thank you so much for being
My
with
pleasure.
us.
Thank you for giving me this opportunity. That was fantastic.
And thank you for being here and investing this time in your health. Informed patients make stronger decisions, and that starts with information you can trust from people actually providing health care in our community. That's why we do this. I'm Carrie Lazarus, and we'll see you next time on Take Me to Kraus.